The other one that we have done, it's a posterior cervical foraminotomy PCF versus ACDF for proximal foraminal stenosis. We have done this service evaluation project last year. So cervical radiculopathy, as you know, is defined as a pain and sensory-motor deficit syndrome caused by compression of the cervical nerve root, usually caused by herniated disc cervical degeneration. Now we have two surgical options for cervical radiculopathy. We have ACDF, and also, which is more popular than the foraminotomy PCF in the treatment of cervical radiculopathy. However, there is still conflicting evidence exists between the two approaches. Therefore, we aimed in this study to investigate whether patients' reported outcome measures favored one approach over the other in patients with proximal foraminal stenosis. So method is a single center retrospective review. 37 patients had either ACDF or cervical foraminotomy were included. We have sent a health questionnaire which included neck disability index, which is basically it's a questionnaire that includes the level, the intensity of pain, the patient's ability to look after themselves, like patient's care, also their ability to lift heavy things, also how this operation affect their job, and also their concentration, reading ability, driving skills as well, headache, if there's any headache post-op. We have also included the EQ5TL, which is also another type of questionnaire that affect, I will show you this one, which also affect the mobility, assist the mobility, the self-care and usual activity like work, study, housework, family or leisure activities, pain and discomfort level, and also this added the mental health consequences of the operation. So we've sent these questionnaires to 37 patients who had this either procedure, either ACDF or PCF. We excluded 18 patients who had both ACDF and ACF. We also recorded the duration of operation, hospital stay length, and also post-op complications. We used MRI scans to find the patients who were mainly having foraminal stenosis, which can be addressed in either approach. Results. The patient reported outcomes scores were available for 17 patients who had ACDF and also 20 patients who had foraminotomy, 4 patients who had foraminal stenosis. Average surgery time in ACDF group was 167 minutes, while foraminotomy was 142 minutes. Average length of hospital stay was 6.2 days in the foraminotomy group and only 3.54 days in the ACDF group. Of the included patients, there were no post-operative complications recorded, and the results showed that ACDF patients had slightly higher satisfaction rates compared to the ACF group. ACDF patients had less hospital stay despite longer procedure times. ACF had the benefits of no implant cost, shorter operating times, but also with longer hospital stay. It also has the advantage of avoiding the ventral approach associated with like major complication, which can be life-threatening, like laryngeal hematoma or also recurrent laryngeal nerve injury. So, conclusion of our study, our data suggests that proximal foraminal stenosis can be addressed by either an ACDF or PCF with no major difference in clinical outcomes. And based on the available evidence, PCF seems to be another good surgical approach in the treatment of cervical radiculopathy. Thank you very much.